Tim Panella. I'm a medical oncologist. So medical oncology is the treatment of adult patients with cancer. Chemotherapy is what a medical oncologist did, but now the category of drugs we use is close to 8 to 10 different types of treatment that we use. I like to practice at the Cancer Institute because of the collaborative, multidisciplinary nature of patient care. A cancer center that has top specialists, that has integrative medicine, that has great pathology and great radiology and great support services. I think the Cancer Institute has friendly people working here, but when I go outside the Cancer Institute, they're friendly people. If you mix all that together, you're at the Cancer Institute. The reason why a person would want to choose the Cancer Institute is we have lots of subspecialty care offers. So we have surgeons that dedicate their life to breast cancer. We have surgeons that dedicate their life to melanoma. So if a person has a disease, they're probably going to have more than one doctor here. And that includes not only the pathologist behind the scenes, the radiologist behind the scenes that reads the film, but the people they directly meet with, and that includes the surgeons, the medical oncologists such as myself. So it's that ability to collaborate, and that ability to have doctors from multiple different angles being available, and doctors and nurses and pharmacists and things that a patient might not even think of. You put all that together and it makes a great place for a patient to want to come. It makes a great place for me to want to practice, kind of all wrapped up together. The way I decided on medical oncology is because it was a subspecialty that was fairly intense. I love biology, I like chemistry, but I also didn't want to just work in a lab. I wanted to be with people and I wanted to be helpful. So if you help people with science, that kind of leads you to just a few specialties, and most of them are in the medical field, and that's how I ended up here. The first patient appointment is patients are very, very nervous. So when you come to see an oncologist for your first visit, you're kind of on edge. And so I want to hear their story. I want to hear what brought them here, what their journey is like up to now. And so first thing I do is listen. So I want them to put them at ease. I want them to understand their disease a little bit. And then I want patients to leave with a clear idea of what to expect. It means, what is their treatment going to be? What are the side effects and what are the outcomes going to be? I also like to introduce the next person. So if I'm going to send them to a radiation oncologist, to introduce that with them too. So a little bit of a bridge between me and the next specialist is what they might expect. Because it's a collaborative approach, it's not often just me, it's our whole team that's involved in their care and involved in achieving good outcomes. When I'm not at the Cancer Institute, I spend time with family. I spend time in my faith. I have a great and wonderful family. I have a loving and supportive wife. I have 3 children, so I have 5 grandchildren. I spend time ski patrol at Catalucci, so I am a national ski patrol, actually an instructor, and I love doing that in the winters. And in the summers, I like being at the lake. Tellico is my favorite lake, and I like to travel.